Okay, let's move on to the second grouping of questions, which have to do with RIFs, the reduction in force. So let's start with Stefan's question. First question over here. I'm probably being removed from federal service this month for declining to relocate. I'm also eligible for retirement. So I have to admit, when I looked at this question, I wasn't clear on the question, and I'm still not clear on the question. Okay, I'll tell you why. Because if you decline to relocate, that sounds like there was a reduction in force, and they came to you with what's called a reasonable offer, and you declined the reasonable offer. If you declined, if I understand you correctly, I don't know all the details here, but if you declined the reasonable offer, well, that means you're not eligible for the RIF, for the DSR. That means you're not eligible for the Discontinued Service Retirement because they didn't discontinue your service. They gave you the option of relocating, right? And you declined that option. So you may have declined what's called a reasonable offer. Declining a reasonable offer is tantamount to quitting. You basically quit. So when you say that you are eligible for retirement, my question is, what retirement? Are you talking about the DSR, the Discontinued Service Retirement, or are you talking about regular retirement? And the answer to your question depends on which type of retirement you're referring to. If you were talking about that you were eligible for regular retirement, you will be able to keep your federal health insurance benefits as long as you satisfy the 5-year rule, which I assume that you did. Okay? So meaning as follows, if you had FEHB for the last 5 years, and now there's this reduction in force, they came to you with a reasonable offer, and you said, nah, I'm not interested. I'm going to choose to retire. If you are eligible for regular retirement or MRA plus 10 retirement, you are able to keep FEHB in retirement as long as you satisfy the 5-year rule. However, Stefan, if you were not eligible for a regular retirement, you're not eligible for the DSR because you declined a reasonable offer. I have news for you. That means you're basically separating without being eligible for an immediate retirement. And if you separate without being eligible for an immediate retirement, you are not able to keep those benefits. Okay? Fine. Let's move on to Jonathan's questions. When RIFed, what are healthcare options and how can I keep my federal health insurance if I take the MRA plus 10 at 57? And how do I minimize financial penalties from taking MRA plus 10 at 57? So, John, your question suggests that you know a lot about this thing called MRA plus 10. Okay? So some of the people in the audience may know, may not know. If you get RIFed, okay, and by the way, just so you guys know, all the questions that I've answered thus far, not only do I address these in my classes, but I have the answers to them written out in articles on my website. Okay, so for example, should you be worried about the new proposed legislation? I have an article about that. And what happens if you get RIFed? I have an article about that as well. Okay, so let's talk about this. If you get RIFed, so my question for you, John, is, are you eligible for the DSR? In order to be eligible for DSR, that means you have to not quit, not decline a reasonable offer, and you have to have either a 50 with 20 years of service or any age with 25 years of service. So, John, if you met those criteria and you get RIFed, you could continue the health insurance and retirement, no problem. Okay. However, John, from your question, it sounds like you're thinking that you're not going to be eligible for the DSR, but you may be eligible for the MRA plus 10 retirement. If you choose MRA plus 10 retirement, you have two choices. You could retire and collect your pension immediately with a reduced benefit, or you can retire and postpone your pension until a regular retirement qualification. Okay? There's a big difference between those two. Aside from the penalty, meaning if you retire and you take your pension immediately, aside from the fact that there's a penalty, you are able to continue your FEHB right away. However, if you choose to postpone, if you postpone until a regular retirement qualification, it's true, you avoided the penalty, but you are not going to have FEHB during those years that you postpone. So, for example, if you postpone from 57 to 62, you do not have FEHB from the age of 57 to 62. That means you're going to have to buy your own health insurance, and you're not going to have a government subsidy to pay for your own health insurance. You're going to have to get your own health insurance on your own, and that's going to cost you a lot of money. I don't know if you guys realize that the cost of health insurance, if you did not have the government paying their 70% or whatever the percentage is, the cost of health insurance would be thousands and thousands of dollars more. I'll just give you an example. If you have a family plan, it's just a regular family plan with FEHB, the government portion alone is about $15,000. So that means if you do not have FEHB from 57 to 62, that means you're going to have to get your own health insurance plan. That means you're going to have to pay not just your portion, but also the government $15,000. If you think about it, 15,000 times 5 years, That's going to cost you $75,000. So if you're concerned about financial penalties, my question for you is, which penalty are you more concerned about? Are you concerned about the reduced pension, or are you concerned about the $75,000 cost of health insurance that you just imposed upon yourself? Just so you know, Jonathan, my general recommendation is, if you're in that situation where you're going to be delaying for 5 years without health insurance, if you're in that situation, I would actually tell you to take the pension right away, with the reduced pension right away. Your rate is reduced. However, if you delayed, the amount of time it takes you to make back what you delayed is about 15 years. And then when you add on top of that the $15,000 of FEHB premiums that you cost yourself for 5 years in a row, it's going to take you like 32 years to break even. So I would just say take it early. There are situations where I tell people to postpone. That's, for example, I'll give you a great example. Let's say you retired MRA plus 10, but you have health insurance through some other means, whether you have a spouse that has health insurance or you have TRICARE. So by you postponing, you don't incur an additional health insurance cost. And there's one more detail. If you postpone, you're not postponing for 5 years, you postpone for less than 5 years. That's like 3 years or 2 years. In the situation like that, where you have the health insurance and you're only postponing for a couple of years, I might just tell you to delay to avoid the penalty. But if you're postponing for 5 years, I would tell you not to delay. And if you're postponing for 5 years and it's going to incur the additional health insurance cost, I'm definitely not going to tell you to postpone. Okay, Kara, I have been RIFed and I'm not eligible to retire. Are there any options for me to access my TSV funds if I need to without being penalized? And Lilica has a similar question. My agency is facing massive RIF if pushed into retirement, which I am eligible for. What is your advice regarding the TSB in that case? So Kara and Lilica, I have news for you. If you guys get RIFed, can you access your TSB? The answer is yes. And I have 2 strategies, or let's say 3 strategies for accessing your TSB. The first strategy for accessing your TSB is the very simple one. If you are age 59 and a half when you separate from federal service, you're fine. 59 and a half is what's known as the age-based withdrawal. You're able to access your TSB without penalty if you're 59 and a half. Okay, so that's number one. That's easy. That's for everybody. Okay. However, if you're not age 59 and a half, then the question is, if you separate from federal service due to a RIF, what age are you? Because that's going to be critical. So, for example, if you are RIFed in the year that you turn age 55, there's something known as the age 55 rule. And the age 55 rule, believe it or not, will give you access to your TSB without penalty. So let me say it again, Kara and Lilica, if you are RIFed in the year that you are turning age 55, you can access your TSB without penalty. Okay? However, if you are below the age of 55, then the only other option for you that I have to access your TSB without penalty is if you use something called 72T. Okay, 72T, the IRS allows you to structure substantially equal payments from your retirement accounts, whether it's a TSB or an IRA or 401k, so long as you structure payments that are designed to last your life expectancy. It doesn't literally have to last your life expectancy. It just has to be designed to last your life expectancy. And by the way, as I mentioned, I have an article that explains this as well. So I would encourage you guys, if anybody here has not yet navigated my website, I have an article that explains what happens if you get separate before the age of 59 and a half and how to access your TSB before the age of 59 and a half.